Pharmacies and pharmacists are the most accessible healthcare providers. We're usually right around the corner and often the first point of contact. We collaborate with patients and the rest of the healthcare team to deliver safe and appropriate medication. We deliver preventative therapies, and our main goal is to keep our communities healthy. Our scope of practice has expanded over the years, and more recently that's accelerated. Differs by province, but the public is most familiar with pharmacists dispensing medications, the good old dispensary counting pills. But we do quite a bit more than that. So every time a prescription is dispensed, we check it against drug interactions. We provide patients with consultations on the medications they receive, so people know how they work, how to take them correctly, how that will impact their life, how much they will cost, how to tie it together with their other medications and supplements. Pharmacists administer vaccinations these days. We provide compliance packaging, medication reviews, and in certain jurisdictions, pharmacists can prescribe for minor ailments, which does take a burden off the healthcare system. Some pharmacies provide chronic condition wellness programs. Some pharmacies compound, which is making medications from a formula. And some pharmacies do a blend of everything. Pharmacists are medication experts, and we can help ensure patients are getting the right medication for their unique circumstances. Pharmacists want the best outcomes for their patients and their communities. These days, patients have options. Medication adherence is another word for a tool to help patients take their medication correctly. The most common type people are most familiar with is the blister pack. This is what patients and caregivers typically see when they request or need compliance packaging in a pharmacy. There are lots of strategies pharmacists can use to help patients with medication adherence. Usually where I begin is to get the patient or caregiver to call or to come into the pharmacy to discuss their specific challenges with medication adherence. Everyone is quite different, I find, in this area. For many people, it's simply forgetting to take their medication. For some people, it's affordability, confusion, or even unspoken concerns about side effects. This is where pharmacists can really help patients. Getting to the root of the issue and really understanding patient concerns is the first step. Imagine if your medicine cabinet looked like this. This may look like a lot to some, but this is a pretty typical scenario. So take that and turn it into this. This is your typical blister pack. So 4 time slots, 7 days in a week, and it's easy to see if you've taken your medication. It's clean and pops out the back. You can add more time slots if you need to. So for patients who are taking something, say for Parkinson's, where they have 6 time slots, they can have them in sequence. We can change the time of day, days of week. It just gives us a lot of flexibility. I recommend that the first step, patients go to their pharmacy. Most patients have somewhat of a relationship with their pharmacist, so they're comfortable coming in and having that conversation. So nothing to be embarrassed about, no judgment whatsoever. This is what we do. We want you to be successful with your medication plan. And my recommendation is to start by having that conversation. So blister packs, someone moving from prescription vials to blister packs, it may seem a little daunting, but once you get going on a plan to ensure that you're taking your medication properly, it actually can be very empowering.